Artificial Intelligence Doctor. User question. Could you please provide the percentage of leadless pacemakers that are associated with the development of fibrosis? That's a very smart and important question, and the short answer is all leadless pacemakers, like Avere VR, Micro VR, etc., cause some fibrosis. But the clinical problematic fibrosis happens in only a small percentage of patients, estimated at about 1% to 2% in current studies. Here's a more detailed breakdown for you. Aspect. Explanation. Normal reaction. Fibrosis, scar tissue formation, around the device tip is normal and expected. The body treats the implanted pacemaker like a foreign body and walls it off. Problematic fibrosis. Rarely, fibrosis becomes excessive and causes issues. Higher pacing thresholds, requiring higher output voltage, battery drain, difficulty retrieving the device, or even device malfunction. Incidence. Based on studies of Micra and early Avere data, significant fibrosis causing clinical problems occurs in roughly 1% to 2% of patients. When it happens, it typically appears after months to years, not right after implantation. The longer a device is inside, the more fibrosis can build up. Risk factors. Multiple implants, replacing old devices. Pre-existing heart disease, especially with damaged or fibrotic ventricles. Higher pacing burdens, the more it paces, the more reaction. Very important. Even when fibrosis occurs, it's usually localized to the tiny area of the electrode, not the entire heart muscle. Problems only arise if the fibrosis is so thick that the pacemaker has to use more voltage to stimulate the heart effectively, which shortens the battery life.
Summary.
Mild fibrosis happens to everyone, normal healing. Excessive fibrosis happens to about 1% to 2%, might lead to higher output settings or harder device retrieval. Would you like me to also show you how doctors detect fibrosis early before it becomes a big problem? They have a few tricks using device interrogation data.